Hi everyone, welcome back to our channel. Today we're diving into a topic that might sound a bit unusual, but believe me, it's a game changer for many women. We're talking about something that affects nearly every woman, yet is undiscussed enough. How menopause affects the female bladder and what you can do to take control. You know, menopause is a natural stage in every woman's life, marking the end of the reproductive years. While most know it for hot flashes and hormonal changes, not many realize that the bladder and urinary system are also significantly impacted. Understanding these changes is key to maintaining a good quality of life. And yes, there are ways to manage these changes. So stick around. We'll talk about all those ways a little later in this video. During menopause, the ovaries reduce the production of hormones like estrogen and progesterone. This hormonal decline doesn't just affect the reproductive system. It also impacts other organs, including the bladder and lower urinary tract. Estrogen is crucial for keeping urogenital tissues healthy. When levels drop, the bladder, urethra, and pelvic floor muscles can experience some serious structural and functional changes. First, the changes in the tissues. The lining of the bladder and urethra becomes thinner and drier. This makes them more sensitive and prone to infections and inflammation. Secondly, the bladder muscles may lose their elasticity, affecting both urine storage and emptying. Lastly, the pelvic floor muscles weaken, reducing support for the bladder and contributing to urinary control problems. Now let's talk about the main urinary symptoms that can arise due to these changes. One of the most common issues is urinary incontinence, which can be stress, urge, or mixed type. This means that you might leak urine when you cough, sneeze, bend down, or even laugh. Another issue is overactive bladder. So this is when you might experience urgency, frequent urination, and nighttime trips to the bathroom. Then there's recurrent cystitis, which means you might face more frequent urinary infections due to the hormonal changes. Finally, painful bladder syndrome can occur, which is characterized by chronic pelvic pain and urgency without an infection. It's important to note that other factors, like age, obstetric history, excess weight, chronic illnesses, and certain medications can worsen bladder issues during menopause. Now, if you suspect you're experiencing these symptoms, don't hesitate to reach out to a healthcare professional. The earlier you seek help, the better. During diagnosis, a healthcare provider will perform a physical exam, check your medical history, ask about your symptoms, and may order tests like urine analysis, ultrasound, urodynamic studies, and may ask you to keep a bladder diary. Based on the findings, they'll develop a personalized treatment plan for you. The good news is that there are several treatment options available. Local hormone therapy is often recommended. It involves using creams or vaginal rings to restore the health of tissues in the urinary tract. Another effective approach is pelvic floor exercises, particularly Kegel exercises. These exercises can help strengthen the muscles that support the bladder. If you want to learn how to do them properly, I've linked an excellent video by a physical therapist below. Specialized physical therapy can also be beneficial, focusing on posture, body mechanics, strengthening the pelvic floor muscles, and sometimes even incorporating biofeedback. Lifestyle changes play a huge role. Maintaining a healthy weight, staying hydrated, reducing caffeine and alcohol intake, and maintaining a healthy diet can significantly improve bladder health. In some cases, medications might be prescribed. For instance, medications are available to help with overactive bladder issues or to prevent urinary tract infections. Lastly, surgical procedures are sometimes considered in more severe cases. In addition to treatment, there are steps you can take to prevent or reduce the severity of these issues. Some simple things that you can do are: 1. Maintain a healthy weight. Excess weight puts added pressure on the bladder, so maintaining a healthy weight can make a big difference. 2. Exercise regularly. Regular physical activity strengthens the pelvic floor muscles, improving bladder control. Make sure to include exercises like yoga and Pilates, which focus on the core muscles. 3. Stay hydrated, but not too much. Drink enough water to prevent dehydration, but be mindful of overhydration, which can strain the bladder. And 4. Avoid bladder irritants. Cut back on or avoid coffee, alcohol, and spicy foods that can irritate the bladder lining. Remember, you're not alone in this. These changes are common and treatable. Taking care of your bladder is part of taking care of yourself. So please don't ignore these symptoms. Reach out to a healthcare professional today and take the first step towards a better, brighter tomorrow. And please share this information with friends and family who might benefit from it. Together, we can make a difference. Until next time, stay strong, stay positive, and stay healthy.